A woman from Aberdeenshire who chose to end her own life in the Netherlands recorded a plea for more to be done for people with severe ME in her final days. Edina Slayter-Engelsman was diagnosed with chronic fatigue syndrome in 2020 and became confined to bed soon after that. As a Dutch national, she took the decision to end her life through assisted euthanasia, which is legal there, because of what she said was the unbearable suffering of living with the disease. Edna's family wanted to share her story with BBC Scotland News in the hope that it would lead to more awareness of the condition. Our health correspondent Lisa Summers reports.
I feel physically, cognitively and emotionally trapped.
This is Edina Slayter-Engelsman describing what it's like to live with severe chronic fatigue syndrome, often known as ME.
I'm isolated from the world outside, but also from my own family and friends. I'm very sensitive to sound, any kind of too much stimulation. I can't really have dinners together or watch telly for 4 years.
Edina, or Ina as her family and friends knew her, recorded these messages just days before she ended her life through euthanasia in the Netherlands. She'd lived in Aberdeenshire for over 30 years, but in 2020 was diagnosed with ME. Within weeks, Ina, who'd been a keen hill walker and cyclist, was bedbound. She describes it as like being trapped in a spider's web.
Every time you try and get out of that, the web just gets tighter and tighter around you. And that's happened over the 4 years until I can't move very much. And this condition has become unbearable to me and has been for a long time now, to the point that I now want to end my life.
The Netherlands has some of the most liberal assisted dying laws in the world. Under strict criteria, it allows voluntary euthanasia for patients experiencing unbearable suffering with no prospect of improvement. Dutch opponents of the policy have said it creates a slippery slope to include more and more diagnoses. A bill being proposed to legalise assisted dying in Scotland is very different. If it were ever to become law, it would only include adults who are dying of a terminal illness, not those suffering from a severe long-term condition. Ina underwent a year of psychiatric and psychological assessments, as well as an assessment by the Institute of Chronic Fatigue in Amsterdam.
They agreed to give me the go-ahead for euthanasia. On the one hand, having to make such a decision has been heartbroken for me. But on the other hand, I feel a huge sense of relief. It means so much to me and my family that I'm allowed to die with dignity.
Ina and her family hope that by sharing her experience, they will shine a light on what it's like to live with severe ME. NHS guidelines show that symptoms can vary widely, with some people able to manage some domestic tasks to people like Ina who cannot get out of bed and need help feeding. It's thought to affect around 250,000 people in the UK, with women far more likely to be diagnosed. Patients groups and charities say understanding of the disease is poor, and that's reflected in the lack of services in Scotland as well as the rest of the UK. Scientists at Edinburgh University are carrying out the world's largest study of the causes of ME. Decode Me is examining the DNA of 27,000 participants to investigate whether there are genetic factors. Professor Ponting leads the study.
We're wanting to find what are the root causes of ME. There will be many. That isn't going to tell people immediately what is going wrong for each and every one of them, but it will tell us what to study, what to do in the future, and that's the key thing.
That's a glimmer of hope for those living with ME, but Professor Ponting says research is still a decade behind other diseases because of a lack of investment. In one of her final messages, Ina makes a plea for others who are struggling.
The main message from this is that living like this for me has become and has been unbearable. There's no help. There should be.
That was the voice of Edina Slayter-Engelsman finishing that report by Lisa Summers. A really tragic story. Let's get more on it now with Sonya Choudhury from the charity Action for ME. Hi, Sonya.
Hi.
A lot of our listeners will remember, like I do, the kind of debate about this illness way back to 40 years ago. There was a really kind of largely ignorant debate. It was called the yuppie flu for a long time, but it's been in our consciousness for so long. Why don't we know more about ME? Is it all about investment?
It's absolutely about investment. We've had a severe lack of funding for research, and as a result of that, our knowledge and understanding is impaired, and we have no validated treatments for people with ME. What is offered is advice around managing living with it.
How much more do we know than we used to about actually what it is? I mean, the real basics. I mean, what is it? Is it like a kind of post-viral illness, a long COVID kind of thing?
So we're one of the partners in the Decode ME study, and our analysis of the first 17,000 questionnaire results indicates that a large proportion of people can identify getting ill following a virus, but not all. There have been lots of small-scale research studies which have given us some clues, but they have yet to be validated, and we see that ME affects all of the body's symptoms, and so it's imperative that we get the research to understand more.
So if you're diagnosed with this now, what kind of help are you likely to get? What kind of treatment is available?
In an ideal situation, and we know this isn't the case for everybody, there's a postcode lottery that exists. In an ideal situation, your doctor would listen to you. They would refer to the NICE guideline, which tells them what they should be looking for, what tests they need to do, and how to make a diagnosis. Referral to a specialist service can be helpful. We know that they don't exist everywhere, and they really vary in terms of what's offered. As a charity, we provide healthcare services and information and support, but there isn't enough in terms of what's available for treatments. There are some drugs that can help individual symptoms, so brain fog, cognitive dysfunction, pain, sleep issues, but there is not anything identified yet as a validated treatment for ME.
Well, the work goes on, as does the campaigning. Thank you very much indeed for helping us understand that a bit more clearly. Sonya Choudhury there from the charity Action for ME.